Today's episode, we're going to look at how we break the chain and how we reduce firefighter exposure leading to burn, bite, or kill you before the next alarm. This episode is about the role that elected officials, chief officers, and others who make policies and decisions based on those policies can impact the exposure that firefighters get with doing the job. Every firefighter knows how to identify the hazards that are associated with the call. We're trained to recognize smoke conditions, structural collapse potential, changing fire behavior, hazardous materials, and entrapment risk. But one of the lessons emerging from modern wildfire science, firefighter health research, and community resilience studies is that many of the risks firefighters face are created long before the emergency response begins. Welcome to Unanswered Maydays. Today, we're asking a different question. If the burn, bite, kill you framework helps us understand how risk develops, where can we intervene? Where can we actually reduce firefighter exposure? What can elected officials do? What can communities do? What can fire departments do? And what can firefighters do? And perhaps the most important is, what does the research tell us about where prevention efforts are most effective? Because every firefighter understands that the best rescue is the one that never becomes necessary. The same principle applies to firefighter exposure. The best exposure is the one that never occurs. One of the most important shifts in modern fire research is the recognition that wildfire disasters, firefighter exposures, and community losses are increasingly shaped by upstream decisions. What happens before the call is ever made? The National Institute of Safety, Standards, and Technology has repeatedly emphasized that in the wildland-urban interface, fires are not simply vegetation fires. They are interactions between homes, infrastructure, vegetation, community design, weather, and human decisions. NIST Fire Risk Reduction in Communities program specifically identifies community resilience and firefighter safety as interconnected goals. That's an important observation. Historically, we've used firefighter safety as something that occurred on the fire ground. Today, research increasingly suggests that firefighter safety begins in planning meetings. It begins with the building departments. It begins in subdivision design. It begins in vegetation management. It begins in budgets. The BBK framework describes this as the burn stage. And if we want fewer firefighter exposures, fewer firefighter cancers, fewer cardiac events, and fewer traumatic incidents, we must begin where the risk is created. What elected officials can do. Let's begin by focusing in on elected officials. So city councils, county commissioners, township boards, state legislators, governors, congressional leaders. Most don't think of themselves as firefighter safety professionals, but many firefighter exposures are influenced by policy decisions that they make. Research consistently demonstrates that building standards, defensible space requirements, wildfire mitigation investments, and infrastructure planning influence community outcomes. The International Wildland Urban Interface Code exists because planners and fire researchers recognize that construction practices matter. Communities with ignition-resistant building standards experience fewer structure ignitions. Fewer ignitions mean fewer firefighter exposures. The NFPA Firewise research demonstrates that mitigation actions around homes reduce wildfire vulnerability. Again, fewer ignitions mean fewer firefighter exposures. So what can elected officials do to help support firefighter health and resiliency, wildfire mitigation funding, making sure that communities have the resources they need to help residents begin to mitigate their properties and extend that into the entire community. Fuel reduction programs, building code adoption. Not always popular, but it does have a positive impact in reducing firefighter exposures. Community risk reduction initiatives, firefighter health monitoring, cancer screening programs, behavioral health programs, and prevention staffing and mitigation staffing, and long-term resilience planning, beginning with the end in mind. One of the challenges facing many communities is that prevention is difficult to measure politically. A structure saved by suppression is pretty visible. A fire that never starts is invisible. But from the burn, bite, kill you perspective, prevention may represent the greatest firefighter safety intervention that's available. And who can put a price tag on that? The second major intervention point is the community itself. Firewise USA research has demonstrated that homeowners can significantly influence wildfire outcomes. Think about that. Things like defensible space, the design of the roofs, vents being shielded, landscaping, vegetation management, combustible attachments are mitigated so that they don't ignite the structures. These decisions influence whether structures ignite. The research increasingly shows that wildfire disasters are often neighborhood problems rather than individual property problems. One hardened home surrounded by vulnerable homes remains at risk. Community scale mitigation matters. This is where the burn, bite, kill you framework becomes particularly useful. Many residents believe mitigation is about protecting property. The research suggests that it is really about reducing firefighter exposures. So not only saving community members, but also saving the folks who come there to help protect the community, the firefighters. When neighborhoods become more resilient, suppression operations become shorter. Fewer structures ignite, fewer firefighters are deployed. Smoke exposure decreases, fatigue decreases, contamination decreases. Community resilience becomes firefighter survivability. The public rarely sees this connection. The burn, bite, kill you framework helps to explain it. Perhaps the greatest opportunity for reducing the bite stage exists within the fire departments themselves. Firefighter cancer literature has changed dramatically over the last decade. The International Association for Research on Cancer now classifies occupational exposure as a firefighter as a carcinogen to humans. That means leadership must increasingly think beyond immediate injury prevention, and that the research now supports several interventions: gross decontamination, clean cab concept, diesel exhaust mitigation, second sets of PPE, gear extractors, annual physicals, cancer screening, use of SCBA, especially during overhaul and initial attack, and exposure tracking, knowing what firefighters have been exposed to. As a firefighter for more than 25 years, I know that I have had hundreds of exposures, but ask me to list them on paper, and I'd be really hard pressed to list even 10, even though I know that I've been exposed many, many times. In fact, every time there was a call. These interventions reduce exposure pathways, and in burn, bite, kill language, that reduces the bite. Leadership also influences staffing, fatigue management, rehabilitation practices, the training frequency, the behavioral health support, and then psychological safety. Research consistently demonstrates that fatigue affects cognitive performance. Sleep disruptions affect decision making. Behavioral health influences operational readiness. Firefighter survivability is no longer only about the tactics. It's increasingly about organizational systems. One of the lessons from systems safety research from James Reason, Sidney Decker, and Diane Vonnegut is that accidents emerge from systems. The same principle applies to firefighter exposure. Departments that systematically reduce exposure can systematically improve long-term health outcomes. Now let's talk about the individual firefighters. This is where the conversation sometimes becomes a little bit uncomfortable because firefighters often inherit risk, but firefighters also influence risk. Research supports several individual actions like consistent SCBA use, proper decon, physical fitness, hydration, rehabilitation compliance, medical monitoring, behavioral health engagement, reporting near misses, and supporting exposure reduction culture. Also, one of the most significant cultural shifts occurring in the fire service today is the recognition that dirty gear is not a badge of honor. Contaminated gear represents exposure and continued exposure. Exposure represents risk. The challenge is cultural. Many firefighters have spent years being rewarded for aggressive behavior. Aggression remains important, but survivability must become equally valued. The future firefighter may need to think not only like a tactician, but also like an exposure manager. That's a new way of thinking. This is a systems way of thinking. Someone capable of recognizing both visible and invisible hazards. So what's next? The research tells us a great deal about exposure, but there are still important gaps. We need better firefighter exposure tracking. We need more longitudinal health studies. We need stronger integration between wildfire science and occupational health science. We need better tools to connect planning decisions with firefighter exposure outcomes. This is the one reason the BBK framework was developed, not as a replacement for existing research, but as a way to connect multiple fields that rarely communicate directly. Community resilience, firefighter health, occupational medicine, community risk reduction, wildfire mitigation, land use planning, behavioral health, exposure science. The next frontier may be creating systems that allow firefighters, communities, and policymakers to see these connections in real time. The burn, bite, kill you framework teaches a simple lesson. The most effective firefighter safety interventions may not occur on the fire ground. They may occur years earlier in the planning offices, at council meetings, during mitigation projects, in departmental policies, through leadership decisions, through homeowners' actions, through prevention, through mitigation. The unanswered Mayday is often the one we never recognized in advance. The fuel treatment never completed. The code never adopted. The mitigation never funded. The exposure never tracked. The lesson, what we could learn from it, never connected. The future of firefighter survivability will depend not only how well we respond, but also how well we prevent. I'm Mike Jensen. This has been Unanswered Maydays. I would like you to be safe, be kind to one another, stay healthy, and remember the most effective firefighter exposure is the one that never occurs. I like to end all my segments by saying, may the mitigated forest be with you.